The Philadelphia area has been one of the hardest hit areas for the opioid crisis. We have actually one of the highest death rates of any large city in the United States. Every year we see about 400 to 600 overdoses in our 3 downtown emergency departments.
We know that previous treatment really fails the majority of the time. Sending an individual out to a detox facility for 3 to 5 days, not only was it ineffective, it's actually dangerous for patients with opioid use disorder.
From the heart, as a parent, you want your child to be off of these drugs. Being off of these drugs really puts people in a position of higher risk for overdose and death. So what we see is patients leave treatment, they immediately go out and use, they've lost their tolerance, and so it's quite common for people to overdose immediately after leaving a treatment facility.
I thought recovery would be easier than what it was in the beginning. I thought I would be able to just go to the detox and then I would be good, and that wasn't the case. And I wasn't doing anything to fix that problem.
So the core model is really unique in that we're using IT support to identify patients more rapidly, and then getting peers to the bedside, and then the patient is speaking with somebody who they have confidence in before they get confronted by a clinician.
Traditional harm reduction is making sure people are safe or meeting them where they are, and that's exactly what we do here at CORE.
My good boy.
Hey, how are you?
Good, how are you?
Now the doggy.
Oh, hello.
Little man. Oh, Buster wants his ball. He's going to show you his toy now.
Oh, that's my toy, actually.
It is your toy, actually. Yes, he's so smart. It's ridiculous. My name's Eileen, and I've been in recovery from opiates for about a little over 5 months now.
Eileen hasn't gone into full-blown active addiction since she's engaged with us. If the CORE model didn't exist, she would not have had a peer in the emergency room to engage with her.
I had somebody there right away in the hospital. It was like an immediate contact thing. I didn't go back out. They didn't give me a phone number to call. They basically picked me up and put me into this, into this program, which is what I needed.
We have this model where our certified recovery specialists, which can go by other names, peer counselors or drug and alcohol counselors, but these are people with a lived experience, and it doesn't help when I, in my white coat, go to a patient and say, you should really try this. What they see is judgment, shame, guilt, me telling them that they should do this. When it comes from Nicole or Bryant, they see somebody who has struggled, and they see role modeling, and they see, an opportunity for a future that they don't see. Unfortunately with me, I might have good intentions, but it just doesn't look the same.
You feel like nobody understands you, you don't really want to talk to people that don't have the experience you do. So seeing these guys come in that had 10 years, 12 years, it definitely gave me hope. I wouldn't have any of this without Nicole and them, so.
Another piece of this is getting patients started on evidence-based treatment. Having patients start on medications, which is what we're doing in the CORE program, is ensuring that they're also protected from overdose. And so that's a big piece of this.
We know that medications for opioid use disorder, especially ones like methadone or buprenorphine, those medications are associated with about a 50% reduction in overall death rate. They reduce ongoing drug use, they keep people more engaged in treatment, they reduce transmission of infections, and most importantly, they improve people's quality of life and well-being so that they can maintain their recovery and do all the other things that are important to them.
The data that they've collected is that 68% of our patients that we engage with in the emergency room are still engaged in some kind of treatment 30 days out, that's pretty good.
We have now treated 3 times as many patients with buprenorphine than we ever did before the initiative. And along with that, and I think equally important, is that using a CRS has increased 12-fold in the emergency departments. And so even when patients don't opt to start buprenorphine, they are connected almost always with a certified recovery specialist who's going to help guide them when they are ready.